Hey guys, so coming to you from my kitchen. As you can see, I have Riley in the background. She's going to help me demonstrate to you how to do these special tests. Now, when you go into Canvas and you see the special test document, it's going to go through all the special tests related to the knee. The purpose of this video is to show you the most important and the most common test. So if you look at your sheet, you'll see the boldface word here. And then to the side, you'll see what it's testing for, which is called the pathology. And then you will also see how to do the test. So I'm going to go big screen now, but we are going to go through Lachman's, anterior drawer, valgus stress test, Varus stress test, posterior drawer, McMurray's test, and then we're going to move down here to the Renee's test and the Noble compression test. Okay, so those are the most common. Here we go. All right, so if we look at the table, when you are testing your subject, you would want to, depending on what you're testing, you're going to be standing right beside them or you're going to be standing to the front of them. So it really just depends on what you are testing. All right, I have my list right here to tell me what special test I'm going to show you. So to start with, we're going to go with ACL. ACL, the first two tests, Lachman's test and anterior drawer. All right, Lachman's test is the most sensitive test and the most important test. And my dog is going to try and help us as we do this. We're making a video, buddy. All right, so Lachman's test, you're going to place your hand on top of the thigh, wrap your hand around the joint angle, and pull up on the knee. Okay, so you're not pulling anything here, you're just stabilizing, and then you're pulling up on the bottom of the knee. Okay, should open up the joint space if it's a positive test. Sorry. Anterior drawer, same thing. Bend the knee. Stop. Bend the knee. And now you're going to pretend like you are opening a drawer. When you open a drawer, you pull forward. All right? So she's got a sock on, so I'm going to sit here on the edge of the table so not to let her foot slide. I'm going to wrap my hands around the knee, put my thumbs in the joint window, and pull forward. Okay? When I pull forward, I'm looking right here to see if that tibia translates forward on the femur. All right? So that's ACL testing. The next two tests, right here, Valgus and Varus, those are opposites. Valgus is an outside force, Varus is an inside force. So with those, we are going to put our hand on the outside of the knee to do valgus, and our other hand's going to be on the inside of the ankle. Okay, so we stabilize here. We do this at 0 degrees, which means it's straight, and push. And then at 30 degrees and push. And we're looking to see if there's an opening in the MCL area on the inside of the knee. The next one is Varus. Varus is an inside force, so we're going to push from the inside, looking for an opening on the outside. So we start with the leg straight, hand on the inside of the knee and outside of the ankle, push, bend the knee, and push. Okay? The next test, as you can see, is going to be posterior drawer. Posterior drawer is the opposite of anterior drawer. So if posterior drawer was for the ACL, posterior drawer would be for the PCL. So anterior drawer we pulled out, posterior drawer we're shutting the drawer. So we still wrap our hands around and we push back. Okay? So you give a little bit of push into the joint. The next test is the McMurray's test. McMurray's test is probably one of the most complicated tests that you will do. It has 9 parts to it. Once you get all parts done, it looks like a couple circles and some twisting of the ankle. All right, so the reason why I want to say twisting of the ankle is because the tibia has to rotate inward and outward. So the way we do that is we cup the heel and we use this as our steering shift. All right, when we bend the knee, we take our index finger and our thumb, turn our hand upside down, make a U, or an N, actually, an upside down U. Put our thumbs in the joint window. And then this is neutral, neutral, meaning we're just bending and straightening. All right, then we're going to guide the lower leg, rotating out and rotating in. All right, still not putting any pressure. That's all in neutral. Now we're going to put some pressure on the outside of the knee and push and rotate with our lower hand. And then we put pressure on the inside of the knee and we do the same thing. What we're checking for here is right here in the joint on both sides, you have the meniscus. All right, remember the meniscus sits between the femoral and the tibial condyles, and it helps with cushion and friction and support. So if you tear the meniscus, it might start popping or causing swelling. All right, and then our final two tests, Renee test and Noble compression, both of those are for the IT band. All right, the IT band is located on the outside of the leg, comes from the ilium up here at the hip, all the way down, iliotibial, so it comes down to the tibial band. So that's what IT band stands for. If she had on Adidas sweatpants or a seam all the way down, the IT band would follow the seam all the way down the outside here. Okay, so for the first one, Renee's test, we're going to stand up on the table carefully. Make sure you don't hit your head. Turn to the side. So IT band runs down right here. Okay, so what we're going to do is we're going to put some pressure here on the IT band right above the knee joint, and she is going to squat. And if at 30 degrees that produces more pain, do it again, it's a positive test. And the reason for that is that IT band right here is going to pop over the femoral condyle. All right, final test, sit back down. Final test is the Noble compression test. Exact same test as Renee's test, except now we are non-weight bearing. So now I, the examiner, will try to reproduce her pain. So I'll grab here, up under the knee, put my hand on the IT band right above the condyle, and then I will bend her knee. As I'm bending her knee, if it reproduces pain or popping, it's a positive test. So, hope you enjoyed the demonstration. Thanks, good thumbs up to Riley. Really appreciate her helping me today. Hope this gives you a good understanding of the special test for the knee unit. This ends our note section.